Well, hello and good afternoon to all who are joining us. Thank you for joining us for this Rails member update for Wednesday, September 10th. My name is Monica Harris. I am the executive director here at Rails, and I want to thank all of you for joining us today. Hope you're enjoying this late summer, early fall weather. This is sort of my favorite weather of the entire year, so it's really exciting to have a little bit out there for all of us. For those of you in schools and academic libraries, I hope that your fall semester is off to a great start. And before we get into our agenda today, I have a few little notes of some general Rails news to share with you. If you are looking for a copy of our agenda, you can find it in the chat. Dan Bostrom just put a link to the agenda there, and so you can follow along as you go. So I know a lot of you are celebrating Library Card Sign-Up Month in September. Here at Rails, we are celebrating L2 Sign-Up Month. So to recognize this, we're hosting a giveaway, and during the month of September, anyone who creates a new L2 account will automatically be entered in a drawing for a $100 Visa gift card. As you all probably know, L2 is for staff and trustees from Rails member libraries, and if you already have your L2 account, please share this information with someone who might not. There are so many great opportunities that come with an L2 account. Many parts of the Rails website are only accessible if you are already logged into L2. So make sure that you're sharing this information with your trustees or with your staff. Now is really a great time to make sure that you're signed up. And we want to make sure that everybody has one. We are also so excited to announce that Northern Illinois University is joining Find More Illinois. As you know, Find More Illinois is our interlibrary loan platform. And when they join, NIU will bring 2 million additional items to our catalog. That brings the Find More Illinois collection to just over 8.5 million. And if you are a library that wants to boost your interlibrary loan, please do check out Find More Illinois. Participation is open to any interested Illinois library, and fees are subsidized by Rails to make participation affordable for libraries of all shapes and sizes. There is more information available at findmoreillinois.org. As always, you can follow along in the chat. Dan is adding lots of helpful links, so if you want to take a look at any of the things that I'm talking about, I encourage you to do that as well. We are also thrilled to announce a $150,000 content boost for eRead Illinois, which is our audiobook and ebook platform. This means more titles will result in shorter wait times and better user experience without any additional cost to our member libraries. $50,000 of that funding comes from an exclusive discount with Boundless, thanks to our vendor Baker and Taylor. Rails also budgeted an additional $100,000 this year that will go exclusively to purchasing audiobooks. We have seen a huge rise in demand for audiobooks, and we are thrilled to be offering this boost right now. As a reminder, this is a really great time to join eRead Illinois. 100% of membership fees go directly towards purchasing new content. So every dollar that your library pays to join eRead goes to purchasing new books for your community. For more information, please visit ereadillinois.com. Finally, there is an opportunity for all Rails libraries and networking groups. The Rails Continuing Education Event Grant is designed to allow awardees to have their say in continuing education. If there is a topic that you, your library, or your networking group have always wanted to learn more about, this is a great grant for you to take a look at. You can apply for up to $2,000 to put together your educational event. Applications are welcome from networking groups, consortia, individual libraries, as long as your event remains open and accessible to all Rails members. You do not need to be a director or manager to apply, but the deadline to submit your application is October 6th. So you want to put that together pretty quickly and get that application in. Once again, the link to that is in the chat. So thank you all for joining. I want to say hi to those of you who have said hello in the chat, but we're going to move on because we have some really great things to cover today, and I want to make sure we have time to get to all of those things. But we are going to start out with some information from Julie Tappendorf, who's a partner at Ansel Glink. Julie recently created a memo on Public Act 104-0056 and the legal aspects of Narcan in libraries. As many of you you know, there is new legislation that is related to how libraries will be expected to provide training and to distribute opioid antagonists. That is going to begin on January 1st, but there's a lot to know. So we wanted to make sure that Julie was here first to explain a little bit about what is in the law. And then some of you have submitted some questions to us ahead of time. So we're going to also answer some additional questions that have been submitted. So I want to kick it off by welcoming Julie. Thank you so much, Julie, for being here with us today.
Thanks, Monica, and thanks, everybody. So I'm sure that all of you have heard about this new law, and some of you are probably wondering how you're going to get enough information and get ready. But I wanted to talk a little bit about who or I should say, what libraries the law applies to, and also what it requires, because it is actually a pretty short new statute. If you haven't actually read the statute, sometimes the General Assembly likes to be very wordy. In this case, I think there's some of the questions I'm getting are because the General Assembly probably didn't provide enough information in the statute. So as lawyers always do, we have to interpret the law as it exists today. There's no guidance or administrative rules on this yet. Obviously, there are no court cases. So we have to look at the specific language in the statute. And so this new law, Public Act 104-56, was signed into law last month. So I think it was on August 1st that the governor signed it, and it takes effect January 1st. The law only amends the Local Library Act. And I know this is probably the number one question I've gotten from my clients, my library clients. Does it apply to me? If you are a library that was established under the Local Library Act, then yes, it applies to you. The new statute specifically defines library as a public library established under or otherwise subject to the requirements of this act, and this act being the Local Library Act. So what does that mean for libraries that are established under the Village Library Act, which I think there's just a couple, or under the Library District Act? Notwithstanding what the governor's press release said, that this applies to all libraries open to the public, based on where this statute went into, incorporated into law, that it only amended the Local Library Act, it only applies to libraries established under that act. Again, notwithstanding what the governor said and what you may hear in the newspapers, had they wanted it to apply to all libraries, the General Assembly could have amended all of the library acts, and they didn't. I'm certain it was an oversight, just based on kind of how people are talking about this, but they had an opportunity to amend it. I think that there was discussion. Hey, is this supposed to apply to library districts that are incorporated under the Library District Act? And nothing has happened. It might in the future. So I know that we have a lot of members here that are members of library districts. I think this will be very interesting to you, because I think at some point, the legislature is probably going to fix this and amend and add specific language in the Library District Act. So what does the act require? There's 6 different requirements in the act. And the first is that libraries being defined as those established under the Local Library Act, shall maintain, I always look at the language, is it may or shall? In this case, it is shall maintain a supply of opioid antagonists in an accessible location. So that is a mandate. That's a requirement that libraries established under the Local Library Act maintain a supply. So that means you need to purchase a supply and you need to store those in an accessible location. One of the questions another question I get asked a lot, well, what does that mean, accessible? And we don't know, because it's not defined. Other terms are defined, accessible is not. But it does say stored in an accessible location. It doesn't say that it's open, that it's available. It says stored. And so the way we've been looking at this, and until we get further guidance or their administrative rules, it's that it's accessible to the authorized personnel of the library that are trained to administer. So it's not in a locked office of the director who nobody has a key to unless she's there. So that is not going to be accessible to the people that need to access it to be able to deliver the antagonist. So that's how we're interpreting it right now, because of the use of the word store, and also because this act is not about libraries providing free Narcan to everybody. It's about making sure that you have a supply and that there's somebody on staff, right? That you have people trained, and that at least during the open hours of the library, that there's somebody available to be able to administer it. So the second piece, and again, I mentioned there are 6 pieces to this. The second is that authorized personnel, so any authorized personnel, and authorized personnel is an employee or volunteer of the library who's completed training. So we always go back to those definitions, which are really important. So any authorized personnel may, and it says may administer. Again, we always look, is it shall a mandate, or is there some discretion? May administer I am going to use the term Narcan. It's the easiest way to understand instead of opioid antagonist. You all know what that is. To any person whom the authorized personnel, again, that library employee or volunteer that's trained, believes in good faith is having an overdose. And that can be administered on library grounds, in the immediate vicinity of the library, or at a library sponsored event. So that language those are the 3 locations that the trained library employees or personnel can, and does not have to, but may administer. It also allows authorized personnel to carry Narcan while they're in the library or at a sponsored activity. And the reason I think that especially that's important is if you have a library activity that's off-site, then that accessible location doesn't really work. So you can bring Narcan with you. It says may carry. It's not an obligation. We always look at that language. The third piece of the legislation is that during operating hours, so when the library is open and operating, a library shall, but then it says take reasonable steps necessary to have at least one person present in the library who's completed the training. So that's that authorized personnel, that there's one employee or volunteer that's been trained, a library employee, so that authorized personnel that is there present at the library during operating hours. And so you will want to make sure that you have, when you're thinking of scheduling, I think this will be really important. I mean, obviously you could train every single employee. And if you're a very small library, that probably makes sense. If you're a very large library, that might not make sense to have every single employee trained. But at the very least, you'll need to make sure that in your scheduling, it says you shall take reasonable steps necessary to have at least one authorized person, one trained employee or volunteer present at the library. And then with respect to training, that can be done in-house. So the library could do it based on the training materials or the information available at the Department of Public Health on their website, or you can send folks to training by organizations that are that provide that type of training. And part of the statute requires the Department of Public Health to provide a list of organizations that you can look to for training. And I think some of that information is already available. So that's number 3. Number 4 is if an authorized person, so if you have an employee or volunteer that's trained that administers Narcan, that both the library and that employee or volunteer is immune from liability. This obviously is very important to you as employees and to the library itself, that you have immunity for administering Narcan unless it was willful or wanton misconduct. And that sounds very legalese. I understand. We lawyers are used to this type of language because the Tort Immunity Act provides a lot of immunities to government entities and employees in different contexts. So you already have immunity for a lot of things. And sometimes that is except for willful and wanton misconduct. So when it gets to that point, and I hope it doesn't, and it would only get to that point if somebody were to sue because you administered Narcan, one of your employees or volunteers administered it, and then the library would get sued. And this would be a defense to that lawsuit. Somebody asks, can we be sued? The libraries can always be sued. It doesn't mean it's a valid lawsuit, and it doesn't mean you don't have very good defenses in this case, which would be a defense. Number 5 is, and this is not a library obligation, this is just more informational, that the Department of Public Health has been directed to identify organizations where you can get training, so where libraries can find trainers, and to make a list of those and provide them on their website. So that is their obligation. And then last, it says, this is number 6, a public library can, it says may receive an opioid antagonist, so Narcan, from any lawful source. I'm not sure what an unlawful source is of Narcan. This is not an actual narcotic itself, but don't buy it off the black market, I guess, out of the back of somebody's truck. There's plenty of places where you can find Narcan, whether it's purchased or sometimes from the counties. I know some of the counties provide it, some of the departments of health. I would say we've got time, not a ton of time, but at least a little over 3 months to identify those sources. And I think that's kind of get the training, find the sources, figure out what accessible location, accessible to you and to the personnel that are going to administer, and just make sure you're ready to go on that January 1st date. So that is a summary of the law, and I'm happy to take questions now.
Thank you so much, Julie. And thank you again for the memo, which is really helpful. In the chat, you can see there's a link to our brand new Narcan Libraries Pulse page. That includes Julie's memo right at the top of the page if you want to take a look for yourself. There are also many other links on that page, which we'll talk about after we discuss some of these questions. But Julie, I just wanted to ask a couple of questions that have been submitted to us from Rails members. And the first is, if the intent is for the new act to apply to all libraries, but it has not been added to the Public Library District Act, should district libraries wait to implement it until it's included in the act? I'm concerned on whether district library staff will have the same liability protections as stated in the legislation.
And that's a good question. You know, again, I think that the state legislature and certainly the governor intended the law to apply, but we need to interpret the law as it actually is. And it's only amending the Local Library Act. So the immunity that's provided in that act would only apply to libraries that are defined under that act, which would be libraries established under the Local Library Act. So there is some risk that a library district or library district employee, if they were to say, you know what, we're going to comply with the law anyway, there is some risk that there is not immunity. There are other potential immunities in state law. There's the Good Samaritan Act. There's tort immunity to the extent that one of the more general provisions of the tort immunity might act for this type of action. I wish there was a better answer. It's sort of one of those, wait, it doesn't apply to us, but what if we want to comply with it? And unfortunately, I don't think that if you were sued, you'd be able to say, oh, well, you know, we fall under this act, except you don't. So it is an open question. I think, you know, to the extent that there's an ability to talk maybe to the ILA to see if their lobbyist has had discussions, and they may have already done this with legislators and the legislature to see if they're planning to address this. It is one of those things that you don't have to comply according to the act. But if you wanted to, you would want to have those immunities. So
Makes sense. And I know a lot of libraries, regardless of whether they're districts or city libraries, are already making sure that
Mhm.
these materials are available within their library. So this would be really good to continue to check on and to work with ILA on. That's a good suggestion.
Yeah.
The next question is, can a library place Narcan in a library's micro pantry? This library says that their micro pantry is browsed by children, and they noticed that the Will County Health Department has placed Narcan in our micro pantry. Would this be considered part of the Will County Health Department's distribution program, and that Will County Health Department takes responsibility for distributing the Narcan, including to minors? Or would the library be considered the distributor and have responsibility? If so, would the library or staff have any liability protections if it's accessed by children?
So, first, the first thing, this is very specific. The first thing is to talk to Will County, right? I mean, you need to find out presumably it is their Narcan and they're responsible for it. And that is not, I would not see that as covering a library's obligations to just say, oh, because you're not storing it, right? You didn't follow the statute, which says that you will store it in an accessible location. The library will, not we're just going to rely on Will County. So I don't think that you could say, oh, well, we're covered because it's available. That doesn't mean that you couldn't come to an agreement with Will County to sort of share resources and say, hey, are we allowed to use this? Can we, have an IGA of some sort to do that? As for whether you have responsibility for Will County's placement of Narcan, I'm not sure how you would, but it never stops people from suing. But the other important thing to remember is Narcan works in an overdose. It doesn't have any sort of negative impacts if you're not overdosing. So we certainly would want to keep this. We wouldn't want it open and everyone's using it because we wouldn't want our supply to be gone. And that's why we say it should be accessible to the people that need to access it and then administer it, but not necessarily accessible that anyone can just keep taking it, because then you're constantly having to refill it, and it may not be there when you need it. But if somebody were to access and administer it and they weren't having an overdose, my understanding, and I am not a medical professional, but my understanding is there isn't any sort of negative impact for that. So would there be liability to have liability? There needs to be an injury or some kind of a damage. And I'm not sure that this situation would create one of those.
Thank you, Julie. The next question you have addressed a bit, but I thought I'd ask it just to make sure that there's understanding. So does the Public Act require that libraries have a supply of opioid antagonists in that publicly accessible dispensary as you're talking about, or can the items be located at a staff service desk?
Yeah, so we don't have a lot of information on this because accessible location is not defined. But one thing, it does not say publicly accessible. And I think that's a difference. It says stored in an accessible location. And if the state legislature wanted to make sure that anyone could access it, I think they would have used the word publicly accessible so that the public could actually access it, as opposed to accessible so that authorized personnel can access it and administer, which is really what the act is for. So again, we don't have a court case, we don't have a definition, we don't have any guidance on it, but I think it's at least a reasonable interpretation that sure, it could be kept at the staff service desk, and then the folks that are trained would know where to get it. That would be accessible because they would be able to access it. If you put it in a locked drawer and nobody had a key that was on staff during hours, that would not be accessible. So I think that's the key, is to make sure that your staff that are trained, that they're able to get to the materials.
This next question, I think, is another one that's going to be similarly difficult to answer with a lot of clarity, but there's a question about essentially when the training that's provided is valid training. So this person says, I had staff at my library participate in opioid antagonist training provided by local health department back in September of 2024. We did not get a certificate of completion for this training. Is there any guidance on how frequently the training should be completed or required proof of the training? And there's a sort of similar question I know in the chat, just wondering if there is anyone who can verify that different trainings available qualify under the law.
Right. So there is not, sometimes we see like if you're Open Meetings Act or FOIA training, if you're one of those officers, that you have to do the training. It has to be this particular training and you get a certificate and then you have to file the certificate. There's nothing like that in this statute. It says that you need to train your, authorized personnel. So those folks that would be on staff and be, able to administer the Narcan, that they need to be trained. You can do the training yourself, or you can have an organization do the training, but there's no requirement that you keep a certificate or file a certificate or reach out to the Department of Public Health, nothing like that. So practically, what I would suggest is for any of your staff that have done a training, whether you do it in-house or you do it outside, is just keep internal records of that staff training. It doesn't talk about annual training, like the FOIA officer, Open Meetings Act, within this, you have to do it annually, whatever that, it's nothing like that. But I think it's reasonable that everybody is trained once. And then if protocols change and we start getting notifications from the Department of Public Health that the protocols have changed and how to administer, that maybe you update training then. But I think keep internal records, because if, and hopefully this never happens, you get sued for administering Narcan, you will have something to say, yes, it was this employee who was trained on X date by Y organization, or we did an in-house training at the library for all of our staff, and here's a record of that. It doesn't have to be formal. Just, you may already keep training records of your employees just as a regular course. Just add this to that.
Great suggestion, Julie. And I can see in the chat, Leighton mentioned that they incorporated the training into their Paycom module, and that's been an easy way to keep track of it. So great suggestion. I just we have time for a couple more questions. So the first one is, are library staff members allowed to opt out of Narcan training and distribution? I have a staff member that's not comfortable administering Narcan to patrons experiencing an overdose.
So it's going to be the act does not apply to individual library employees. So the act does not say every employee of a library established under the Local Library Act must be trained. That's not what it says. It places the obligation on the library to have at least one trained staff member available, right? Shall use reasonable steps to have somebody trained. So you, as the library and the library directors or business managers or HR, are going to have to determine how to make sure that you can meet that statute. So if that is if you are a very small library and that is your only employee on duty on Sundays, that's it, then you might have a problem. Because if that person refuses to do the training, refuses to be available and to administer, that's going to be a scheduling issue for you as the library. And while there's no penalties attached to this statute to say, oh, it's this, it would be a violation of the law if the library doesn't comply. So I think that is going to be a scheduling thing. If that employee is the only employee, it could be a problem. Maybe that's part of their need job duties if they work alone. Would you have to have a second person there? Maybe, to make sure if they wouldn't. So I see that more as an employer-employee issue than a compliance with the act, because the act requires the library to use best efforts. And actually the language is stronger than that. Shall take reasonable steps to make sure that you have somebody on staff available. For larger libraries, it would seem not as difficult to make sure that at least one employee on every shift at any point in the library is adequately trained.
We do have a couple of follow-ups also similarly from very small libraries who might be staffed with only one person, or some folks who have a curiosity if they have someone who is on a bookmobile or doing home delivery to a patron's home and they see something that might be an overdose, if that is also something that is considered under the law.
Yeah, I've not seen anything in here when it talks about having somebody on staff. It says during operating hours that the library shall take reasonable steps necessary to have at least one person present in the library. So it doesn't talk about having somebody present in the bookmobile or at a library sponsored event. You can be, so you could carry those, and you can choose to have Narcan with you on the bookmobile, but it doesn't require that. It doesn't require that the person in the bookmobile, but having one person present is specific to in the library. So that may help a little bit. That everywhere the library is does not require a staff member who's trained. But on the other side of that, you may want to.
One last question for you, Julie, and this is one who wants to know if you have heard of any discussion around other types of government entities being required to have Narcan as well, like park districts or townships, or is it just libraries at this point?
Yeah, that is a great question. And frankly, I was surprised that it was just sort of targeted at libraries. I think that some of it is the type of the populations that are frequent in libraries. At least I read some of that in some of the press release. Why is this a requirement? Well, because there might be a larger group of folks that are coming into libraries that may be vulnerable, and it may be more likely than, let's say, at a park district at the pool or at the park district fitness facility or other facilities. And also the libraries are manned, so there are employees. If you think about public parks, park employees are not just at a public park. They may be at the pool and they may be at the fitness facility, but they're not staffing open public parks. All that being said, I think we're moving into a direction where we're going to see more laws like this, and we're going to in an attempt to try to stop deaths from overdoses, to see if there are ways that the state police and the local police cannot be everywhere, and the EMTs cannot be everywhere. And so I think the thought is we need the Narcan and trained personnel maybe where vulnerable populations may be. So I would say stay tuned, that this could certainly be expanded.
Julie, thank you so much, as always, for your expertise.
Yeah.
We are so grateful for the information that you bring to libraries and your willingness to answer our questions. Thank you.
Thank you.
Before we move on to our next speaker, I just want to make sure that everybody is aware of some of the resources that we have at Rails around this. So I know you saw that Dan put a link to the Pulse page. For those of you who are looking for training, I just want to make sure you are aware that the DuPage County Health Department is offering an online training on September 16th from 2 to 4 p.m. There is a link on the Pulse page to that. Rails has also worked with an organization called Live for Lolly to administer a training from 10 to 11:30 on November 13th. So you can also register for that now, or have your staff register for that training. We have been in conversation with Live for Lolly, and they have communicated that they are willing to distribute opioid antagonists to libraries who need them. So at this point, they will deliver to any library in Cook, Lake, DuPage, or McHenry County, and they will ship it to any Illinois library outside of those counties. There will be more information about that at the training, but we do have a link near the bottom of the page in resources to Illinois overdose prevention providers. That sort of goes county by county and explains, depending on what county you're in, who you might work with. And the Live for Lolly contact information is also listed there. So just wanted to thank you all for this information. I know that there's still a lot of questions out there about how to move some of these things forward, and we will give you as much information as we can. But we are lucky in Illinois that we have had some folks who are really leaders on this issue, and Chicago Public Library has certainly been at the forefront of providing opioid antagonists to their patrons. And so we're very fortunate to have with us today Maggie Clemens, who is the Deputy Director of Library Operations and Patron Experience at the Chicago Public Library. And she's going to share with us a little bit about their program. Thank you so much for joining us today, Maggie.
Thank you so much, Monica, and thank you to all of Rails for having me here today. This is just a really special partnership and program for Chicago Public Library. And I think just after listening to Julie and some of the questions that came up, I'll spend the most time talking about, how, where, and who we have done this at Chicago Public Library. And I do want to start off by saying that this did not come about because we were seeing an increase in overdoses in the libraries. We were not. And we have not been since we have implemented, and I'm just going to say Narcan too, at our locations. This really came about from, some just personal observations and experience. And data-driven decision making from our public health department in Chicago. So, little story, I was at one of our West Side locations in 2019, waiting for an interview to start, waiting for the candidate to show up. I was looking out the window and saw an individual who was in distress in the alley behind the building, called 911, went outside to direct them there and to see if there was anything to do in between. The ambulance pulled up and I waved them down, went to direct them where they were. And they said, "Oh, we're not here for that call." There was another person on the other side of the street that I hadn't seen who was also in some sort of distress. It was all, both were overdose related cases. And there had been like 5 other calls within, I think, that 30 minutes for overdose related incidents like around the library. So, I noticed this, I saw this, I started looking into like what's happening here at this location or in this community specifically. Found out that it is a community that does see a high, I think there was an open air drug market, honestly, like not too far away. And so a high, that was happening. And then, people were overdosing and at different times of the month and in different, whatever it is, what they were using would be different strengths and impact people in different ways. I took myself to a public health training on Narcan. It was the first I had really started hearing about it. And then, in 2019 or 2020, we were all very busy with another public health related issue. But the public health department then reached out to us late 2020 into 2021 with a lot of data on the opioid crisis in Chicago. And they saw an increase. In 2020, there were over 1,300 people who died of an opioid-related overdose in Chicago, which was about a 52% increase from 2019. And they were just seeing those numbers rise. And they believe, as I think we all believe, that libraries are just trusted, accessible spaces, and often the first point of contact for really vulnerable individuals. And in just locations within communities where people can, are going for information and other resources and connections. So they reached out to us, asked if we would be interested in piloting at 14 locations is what they came to us in communities that were seeing higher opioid related overdoses. And we said, yes, we'd be open to that. Before we implemented anything, we did do a lot of communication with our staff. We are over 90% union staff. We are AFSCME. And while we did not need to bargain related to what we were moving forward to with the public health department, we did need to inform them and answer any questions and concerns. So where we landed was CDPH would provide training. Training would be mandatory for managers. And the information about the initiative would be mandatory for all staff. We were not asking any staff to administer Narcan to any potential or actual overdose, if there was anyone that did overdose at the library or on the property. Although we did reiterate that if anyone is in crisis, medical crisis, staff are expected to call 911. So there's that. And if you staff do choose to administer Narcan, they would make the 911 call first and then move forward with administering. And staff or union really wanted to make sure that staff would not be disciplined or there'd be any negative impact at all to staff if they decided to not administer Narcan to anyone who might be in need or they thought would be in need. So we agreed to all of that. We do have our Narcan in a publicly accessible location. And they are in, or the units are in at first they were in like a first aid kit that we mounted to a wall near the entry point. We have moved away from the first aid kits and they're in a clear container that is affixed to the wall that has signage about what it is, who to call, etc. And then within these containers, we have had additional public health tools added. So fentanyl test strips at some locations, maybe some like cards on recovery resources, etc. So we started with 14 locations in January of 2022. We had planned to just expand by May to about 27 locations. It was so well received by staff after our initial few conversations back and forth with the union. I think that they all felt very supported in where we landed and how we were providing this and the information that was provided both to staff and the public. That CDPH asked if we could expand to every single location. We have 81 of them by the end of the year. So we started, while the first rollouts were based on data in areas of high need. After we decided to roll out to everyone, we did it by geography. So starting up, north and doing the branches around there and then moving south till everything was complete. CDPH, our public health department, trained all of the staff. There were virtual trainings, there were in-person trainings, and we made the trainings available afterwards, the deck available to staff through our staff and organization development platform. And then the city's Office of Emergency Management and Communications started incorporating Narcan training into their Safe Chicago education work, which is CPR, now Narcan training, as well as they started installing a Stop the Bleed kit in every one of our locations and AEDs pretty soon after the Narcan initiative started. And so our Stop the Bleed kits are really to respond to any sort of potential gunshot wounds or other major accident or incident that could happen. Again, not in the library, but perhaps nearby in the community. So there's bandages and tourniquets and items like that. This also led to, Julie mentioned the Good Samaritan law, and that was another concern that the union had, that if a staff member did decide to use Narcan on someone potentially experiencing an overdose, would they then be disciplined if they decided, or would they be supported by the city if the individual experiencing the overdose, either didn't want that in between, or that sort of resuscitation happening, with the city support. And, we did land that the city will, and that staff are covered under the Good Samaritan law. I'm just looking through my notes here to see what else. So we also started a pilot program offering fentanyl test kits. And then we have another pilot that's really working out well. The public health department has 2 public health vending units at our locations. There's 5 across the city right now. They are looking to expand. We have 1 at our central library, and then 1 at one of our branches in the Uptown community up north. And those vending units are really geared towards people who are experiencing, using drugs, need some sort of like intervention, and perhaps be connected into the public health system in a non-traditional way. So everything in the vending unit is free. Narcan, you do not need to have a profile or anything just to access that. But if there are other items in there, such as a hat, there's underwear, there's like safe sex kits, there's socks. It all changes based on the season and based on what CDPH is seeing. You do need a PIN number, and you can get that from the library staff, or you can get that via the unit itself. And then you are connected into the public health department. And we have just had such great success. And as there was this question, and as Julie was saying as well, like, are other departments doing this? The Chicago Park District has reached out to us, and they are very interested in having Narcan at maybe not all of their parks, but seeing how they can roll it out in certain spaces and places. Really, their sticky point at first was just, how did you do this with so many locations and all of your staff? And staff represented by a union. And so we've talked them through that. And so they are working on what their plan will look like. I don't have full numbers right now, but I just have numbers from May until I think the end of August. We had 4,000 units distributed across 52 locations in just those few months. And CDPH reset the program this year, and the way that we are distributing, or they're distributing the Narcan. So it was, as supplies diminished, branches were reaching directly out to CDPH. It was a lot of communication, a lot of coordination, a lot of logistics. So they're trying to streamline that and give a set number of Narcan units to locations based on the data and where they are in communities of high opioid or overdoses versus non. And then from there, they will check in monthly and see where they're at with their supply. And then they have visited every location. I think actually they're finishing up next week, but they're revisiting every location just to connect with the manager, other staff, if they have questions, talk about trends and things that they're seeing, and what other support might be needed. So that is where we are right now. Other agency, the aldermanic offices in Chicago are interested in having Narcan in their offices now, as well as the Chicago Housing Authority is looking to see how and where they can supply at their facilities. And again, it's been really a positive experience. And again, we're not seeing more overdoses. We weren't seeing many to begin with. It's really empowering people who may need it, even if they're not, a drug user or at risk of overdose. If you go in for surgery and you're sent home with an opioid to recover, you could be at risk of overdose. So just normalizing it and having this harm reduction language and narrative in communities just builds for healthier communities.
I mean, I think it's so encouraging to hear how the staff have embraced it, but also to hear, the support that you have received from your public health department, but also, other agencies that want to continue your work and continue it further. I think all of that is really positive. I just had one question for you, Maggie. I'm curious if you have landed on a cadence at Chicago Public in terms of how often you provide training to staff.
Oh, that's a good question. For new staff, it's available as a recording, and we haven't landed on as at that like, oh, this is something that's every year required. Because as Julie was saying, and it's pretty like nothing has changed in terms of how to administer or any part of the program right now. So I think for now it's something more to change and for new staff.
Well, yeah, making the video available for new staff, I think is great. And I think for those of you who may not have been monitoring the chat, if you kind of scroll back up the chat, Leighton Shell, thank you, Leighton, was kind enough to share a link to the Cook County Public Health Department recording training. So that's something that staff could access right away, as opposed to waiting for some of the trainings that we talked about earlier. Maggie, thank you so much for being here with us today. We really appreciate your time and your willingness to share your experience at Chicago. Thank you.
You're welcome. Thank you.
Good. We are now going to move to some demonstration of our brand new Rails resource sharing map. I'm so excited to have Grant Halter, our Rails data analyst manager, to speak to you a little bit about the work that went into the map and give you a great first look. So welcome, Grant.
Hello, thank you, Monica. Thanks for having me, everyone. We're very excited to show off the map and all of the things that went into it. So without further ado, I'm going to go ahead and share my screen and give everyone a little demo. So this is the new resource sharing map. It's a big upgrade from the old map that was a static PDF that served its purpose for a long time, but we had the ability to get this new Esri ArcGIS product that lets us build more dynamic maps that allows us to update this map and other maps more often with more detail and more data in them. So we're really excited to have this going forward. I know there's a lot of requests for other maps and things, and trust me, they are on my list, and we will share them as we get down that project list. There's lots of opportunity. If anyone ever has any questions or comments or requests for maps or features, please email communications or myself, or submit a feedback form on the map directly, and we'll follow up with you. So here is the map. It'll default to this about page and these tabs on the left, and you'll be able to view a legend for each of the layers, a list of the layers that you can toggle on and off, filters, and a submission survey that people can access directly just for your ease of use. So this map defaults to what the old map showed, which was the public library service areas colored based on their LSAP affiliation. That's what you're seeing here. You'll see the colors are a little different than what they used to be, but that's just kind of part of the new redesign that we get. You can zoom into the map and you'll see things change. Labels will pop up. Library points for library buildings will show up for ease of access. If you click on a library shape or point, you'll get some information that has a link to their L2 page for more information, a list of the Rails resource programs that they're involved in as well. I'll also show a quick, this search tab lets you search any of the layers on the map. So you can find buildings or the service areas or just the geocoded map. If you click one, it'll zoom you into that piece that you were interested in, where you can do what you like. That may be a point where you take a screenshot of the map, share that out as you like. So that's that. There's other layers on the map. Oops. You see the buildings will toggle on and off. We also have just the general library system service area here that also has a click that shares some information and a link to our website, as well as Heartland and Chicago Public, as well as county overlays, if it'll load. There we go, that you can use as you like. There's no pop-up for counties yet, but that'll be coming just for some useful information. Other features are, if you click this arrow, there's an attribute table that you can export with any filters that you've run or anything, just to get this base data a little easier and more accessible. And that will also change dynamically with all of these filters, which are the most fun part of the map. I think if you click one, it'll just zoom into the map, hide everything else, and gives you that. You can include multiple of all of these things, and it'll zoom in and out as it processes. Lots of data going on here. An example like that. We reset it, show Rails libraries only, very cool. As well as the kind of the filters of our Rails programs down here. So you can click and see all the Find More Illinois libraries, public libraries. With this filter, eRead, Explore More, and Lincoln. Of course, Wilkes County. This was a cool one. This will show you all the libraries in a specific county as well, which is a neat little feature. Can also, yeah, like I said, submission form is at the end here. Quick little tweet length comment that I will see directly and will respond if you want to leave your contact info or just have a blatant feature request for me to look at. We'll get to those. You can also print or kind of get PDF versions of the map through this icon, or share the map directly through social media, or get a link for that as well. I know that was a quick run through of all the fun things in the resource sharing map. If you want more detail, we'll be doing a showcase on September 24th from 2 to 3 o'clock. Well, I'll be doing another demo, and the rest of it will be open for questions and comments for everyone to react to. And with that, I'm going to pass it back to Monica or Dan.
Thank you so much, Grant. We are really thrilled to have this resource sharing map ready to show to you. This is the first time there's been an official update since 2019, so lots of changes in the marketplace since then. But the really exciting part about all the work that went into this map is that it'll be updated on a super regular basis, and there's also opportunity to continue to add features eventually, as Grant shared. So in the chat, you can see that Dan included emails for the communications team, as well as Grant's email, or there's that form that's on the map that you can take a look at if you want to add some questions, suggestions, things that you want to know about the map. But definitely encourage you to take a look at it, play around with it, see what you can see, and learn about the service areas across Illinois. Thank you so much, Grant, and thanks, of course, for all your work on this program.
Actually, Monica, can we do one quick question for Grant? This is an interesting one. Yeah, Grant, the question is, are the shape files available for download?
They are. That'll be a direct request from me, and I will say that my shapefile is slightly out of date compared to the state libraries, which I'm working with to get connected with them so that we're better synced up. But the answer is yes, and that's not just the whole shapefile. I can squeeze that down to just your library or region or things like that. So yes.
Awesome. Thank you so much, Grant, and thanks for that answer. I know we are just 2 minutes short of the hour when we were going to end. If you briefly want to enter any library news that you have to share about your library in the comments, happy to share that with you all today. But I do want to thank you all so much for being here. We know we've had a lot of questions about some of this new legislation, and it was really helpful to have our guests here to speak with us today. I do, of course, also want to thank Grant for that, showing off that brand new resource sharing map, and want to encourage all of you to take a look and to use it. Well, if there's no new library news to share, we're going to go ahead and adjourn for today. Thank you for joining us. Please take a look at all the resources that were shared, and we'll look forward to seeing you again soon or seeing you at the ILA annual conference. Bye, all.